Good morning. Good
Good
morning.
morning, ma'am.
Ready for the seminar? Ready? Do you want 5 minutes to read? Yes. Who is starting? Which is the first portion? Rishma. Okay. I'll give you 5 minutes. You can read. Do you have a PPT?
Yes, sir.
Okay. These presentations might be included for your internal marks also. So make sure that you don't read from your PPT. Okay. You have to explain. Just a seminar, not a reading test. Fine. If you are not ready, just tell me. I can give you another day. Others, please take page number 119. The textbook, 119 of the textbook. Chapter Attitude and Social Cognition. From there, I think social cognition topic that is deleted. From there onwards, it is deleted, I think. If there is any change, I'll inform you. Okay, in that chapter, from social cognition onwards. Then the next chapter, that is social influence in group processes. Page number 138. Conformity, compliance, and obedience. Page 138. From there, it is deleted. Okay. So we have only that part ones of this chapter to complete. Fine. With that, we'll finish class 12 psychology theory portions. And officially, we'll finish the theory portions for this course. I hope you all have noted the change of portions for MCQ test. Please don't keep studying psychological disorders and therapy. That is for term 2. According to the new syllabus, it is for term 2. So you have chapters 1, 2, 3. That is variations in psychological attributes, then the self and personality, and the third chapter, meeting life challenges. That one. And according to the information that we got, the question paper will be from the board. CBSE question paper. So obviously you have to prepare very well for the MCQ test. It won't be as simple as you have had until now. Application level questions are also there. I've also included application level questions in the upcoming test. Okay, so prepare well. After this class, we'll start the revision until exams. Because already we have completed the portions, 2 chapters for term 2. So it's okay. Okay, shall we start, Samina? Reshma, I have enabled screen sharing. You can start.
Okay. Ma'am, is it visible?
Yes.
Can I start?
Yes.
Good morning to all. Today I'll be taking a seminar on the factors contributing to healing in psychotherapy. We already know what psychotherapy is. It is the treatment of psychological disorders and difficulties through conversation between the therapist and client or clients. And it is also called talk therapy because of this. Now, in psychotherapy, there are various factors that contribute towards the healing of the client. Broadly, there are 4 factors. The first one is the technique of treatment adopted by the therapist and how it is implemented in accordance with the client. Other factors include the therapeutic alliance and catharsis, which we will learn about later. The last factor is a combination of factors called non-specific factors. Now let us look at the first factor. As we all know, there are many techniques and methods of psychotherapy. These are associated with different schools of psychology, or it can be based on a combination of theories like the cognitive behavioral therapy, or there is another form of therapy called integrative therapy, in which the therapist doesn't strictly follow any one approach, but he or she blends elements from different approaches and tailors it according to the client. The 5 main approaches that are most widely used are cognitive, humanistic, psychodynamic, behavioral, and gestalt theories. The therapist chooses any one or more of these approaches, which is appropriate for the psychological problem faced by the client. The type of therapy chosen by the therapist and the ways in which it is implemented, it plays a major role in the healing of the client. The most effective and widely used form of therapy is the cognitive behavioral therapy, which we've learned is also known as CBT. It is said to be the most effective because it can be used to treat most psychological disorders faced by clients. Here we can see the variety of disorders that can be treated using CBT. These disorders include anxiety, depression, panic attacks, addictions, eating disorders, anger issues, and phobias. Now, each type of therapy has a group of disorders for which that treatment can be effective. If, for example, a client is diagnosed with depression, out of the 4 types of therapies given here, which are psychodynamic, humanistic, CBT, and behavioral, only 3 are suitable for treating the client with depression. Psychodynamic, humanistic, and CBT are effective therapies for this disorder, but behavioral is not. So the therapist may choose any one of the 3 disorders according to the client and the severity of the disorder, and whichever therapy is chosen, it will majorly affect the healing of the disorder in the client. The next healing factor is the therapeutic alliance, which is the special bond created between the therapist and client during therapy. In the beginning of this chapter, we learned about the 2 major components of a therapeutic relationship. So according to our textbook, the 2 components are the contractual nature of the relationship and the limited duration of treatment. The contractual nature means that both the client and therapist, they are willing to participate in therapy to help solve the problems of the client. They both will want to work on the problems of the client. The limited duration of the treatment is another factor. The therapy sessions will continue until the therapist feels like the client can deal with their problems on their own, or they can take control of their own life without the help of the therapist. We have also learned the unique properties of this alliance. The relationship is characterized by trust of the client in the therapist, to such an extent that he or she is comfortable to share their most personal thoughts and experiences with the therapist. The client unburdens themselves of their stressful and traumatic information, which results in a process called catharsis, which we will learn about. The therapist encourages this unburdening of emotions by being accepting, empathetic, genuine, and warm. Even if the client is rude or has done something illegal, the therapist will not judge them and will still show positive feeling towards the client with the belief that the client can change for the better. This is called unconditional positive regard that the therapist has for the client. The therapist will also be empathetic towards the client, which means that the therapist genuinely feels for the client and can understand the situation from their perspective. Empathy is very important in a therapeutic alliance because it enriches the relationship and it transforms it into a healing relationship. The next point is the strict confidentiality kept by the therapist. The therapist should not disclose to anyone the personal experiences and thoughts shared by the client. The therapist must respect the trust and confidence the client has in them and should not exploit it for their own reasons. The last point is that this alliance is a professional one and it should remain like that throughout therapy. It is neither a passing acquaintance nor a lasting and permanent relationship. Now we come to the topic of why this therapeutic alliance is said to be healing for the client. The first reason is the regular availability of the therapist. Usually in therapy, the therapist schedules sessions within the duration of treatment according to the severity of the disorder in clients. They can be weekly or monthly or any other way. The client updates the therapist on their mental health after each session, and the therapist accordingly plans forward. Now, this regular visit to the therapist to relieve themselves of their distress is healing to the client. The second healing factor is the warmth and empathy provided by the therapist. The therapist shows behaviors that make the client feel comfortable and also allows them to share their feelings and to be vulnerable. We have already learned what empathy is. The picture here shows the difference between empathy and sympathy, which can be mistaken for each other. In sympathy, a person feels sorry for the person suffering and has feelings of pity and compassion for the person. But beyond this feeling, the therapist actually understands the plight of the other person as if they themselves were in that situation. And there is another situation called intellectual understanding, similar to this, in which the person just observes and understands the situation of the other person and is not even sympathetic towards them. The therapeutic alliance was first described by Sigmund Freud in 1912. Since then, many other psychologists have contributed towards this topic of therapeutic alliance. Finally, it was concretely defined as the collaborative and effective bond between therapist and patient, which is an essential element of the therapeutic process. Now we have the three components of a therapeutic alliance as given by Edward Borden. We already saw the two components of the therapeutic relationship as given in the textbook, but the components given by Edward Borden are the most widely accepted and learned, and it is similar to the ones given in the textbook. The first component here is the agreement on goals. The therapist at the beginning of the treatment sets a number of goals of improvements in the conditions of the client. After understanding or after diagnosing the problem with the help of the client should be cooperative also. These improvement goals are to be reached during the course of the treatment. This is also called collaborative goal setting. The next point is agreement on interventions. This is a process of providing the patient with information and supporting them throughout the decision making process. This is why it is also called shared decision making. The last point is the therapeutic relationship or the effective bond between the therapist and the client. We have already talked about the importance of this relationship in the healing of the client during therapy. Now we move on to the third healing factor of therapy called catharsis. During initial sessions of therapy, a client may feel vulnerable and share or unburden the emotional problems faced by them. This emotional unburdening is called catharsis and can be healing to the client. It is a concept in psychoanalytic theory wherein the emotions associated with traumatic events come to the surface. When we say surface, we mean the consciousness. We have learned about Sigmund Freud's theories about the unconscious, which reserves repressed thoughts and inner conflicts within the person. His theories also give importance to traumatic events that may have happened during childhood. He had also developed a therapeutic procedure called psychoanalysis, in which these repressed conflicts are brought to the surface or to the consciousness with the help of the therapist. So when this happens, the client may have an emotional breakdown, which will relieve them of this repressed stress, which has caused problems for them over the years, whether it may be mm, trauma from childhood or any other reason. So this is why it is said to be an emotional release. The word catharsis comes from the Greek word katharsis, which means to cleanse or to purify. The purpose of catharsis is to bring about some form of positive change in the individual. That is, when someone finally understands the root cause of their mental difficulties and can work on them, then they are able to be more aware of themselves and live freely with peace. So, this is the effect of catharsis on a client. Catharsis involves both a powerful emotional and cognitive component. Emotionally, the person feels and expresses strong feelings about their past sufferings or their trauma. In the cognitive component, the client gains new insights about himself or herself, which will help them to understand themselves and solve their own problems better. So, I hope you've understood the topic of catharsis. The last healing factor of psychotherapy are a combination of several other factors called non-specific factors. They are called non-specific because they are not the same for all therapists and clients. They vary across different forms of psychotherapy and across different patients and clients. Some of these factors are concerned with the therapist and others are concerned with the client. Non-specific factors attributable to the therapist are called therapist factors, and factors attributable to the client are called patient variables. Some of the therapist variables are positive nature, absence of unresolved emotional conflicts, and presence of good mental health. These are characteristics that a good therapist should have. He or she should be patient and have a pleasant, welcoming nature. He or she, they need to first resolve their own mental conflicts and make sure that their own mental health is taken care of so that they can help their clients in a professional and effective manner. The patient variables are characteristics that a person needs to have in order to cooperate with the therapist and be a good client. These include motivation for change, expectation for treatment due to the expectation of improvement due to treatment, etc. Basically, the client must have faith in the therapist and feel the need for change and their own betterment. The client must feel that this therapy is needed for them and they should want to be better too. Now, we'll summarize the whole topic in short. So, in the beginning, we saw that there are 4 factors contributing to healing in psychotherapy, which are the therapeutic techniques and their implementation, the therapeutic alliance, catharsis, and non-specific factors. Then, in the techniques and implementation, we learned about the different approaches and theories in psychotherapy. We saw the 5 main approaches based on cognitive, humanistic, psychodynamic, behavioral, and gestalt theories. Then we saw the various disorders CBT or cognitive behavioral therapy can treat, and also that it is one of the most widely used and effective methods of therapy. Then we saw an example of a situation in which the therapist has to choose any one of the 3 approaches which are suitable for treating depression according to the case of the client. Here, only 3 out of 4 types of therapy, 4 types of therapy, that is all the methods except behavioral therapy, were effective treatments for depression. Then we moved on to the next point of therapeutic alliance. Therapeutic alliance, as we said, is a special bond between the therapist and client. Then we saw the 2 major components of a therapeutic alliance and its unique properties as given in our textbook. The 2 components were the contractual nature of the relationship and the limited duration of therapy, and the unique properties were 7. A trusting and confiding relationship, one that enables the client to open up and unburden and confide their problems. Encouragement of the therapist by being genuine, empathetic, accepting, and warm. Then the therapist shows unconditional positive regard and empathy towards the client. The last 2 points are that the therapist should keep strict confidentiality and that this relationship should remain a professional one. Then we saw the healing properties of this alliance, which are the regular availability of the therapist and the warmth and empathy provided by the therapist. I also talked about the picture here, which shows the difference between sympathy and empathy, and we also learned about intellectual understanding. In the next slide, we saw some out-of-syllabus topics about the proper definition of therapeutic alliance and the 3 components of a therapeutic alliance by Edward Borden. Then we learned about the third healing factor, catharsis, which is the process of emotional unburdening of a client during therapy. We saw how the word originated and what the purpose of catharsis is, and also how it involves a cognitive and emotional component. Then we moved on to the last point, a combination of factors called non-specific factors. It includes both factors attributable to both therapist and client, called therapist and patient variables, respectively. And finally, we saw some examples of these factors. So I hope all of you understood these topics. I conclude my seminar. Thank you.
Okay, very good. Yes, questions? Grishma, you can ask first. Switch on your videos, everyone. Grishma, questions?
Yes, ma'am. Uh, what do you mean? What do you mean by catharsis?
What do you mean by catharsis?
It is the process in the therapeutic relationship where the client emotionally unburdens himself or herself to the therapist.
Yes. Have you seen the movie My Boss? Yes. In that, when this person is very angry at the boss, what do?
Break the buckets in the toilet.
They go to the washroom and break the buckets. Some people consider this as a form of catharsis. They are emotionally unburdening. Hmm? Then it can also be considered as displacement in our ego defense mechanisms. Hmm? Then there is one method, like if you're very much depressed or very much anxious about something, you can write that on a sheet of paper and light a candle. You have to light a candle and burn it. Some people say that this is also one form of catharsis, but there is no scientific evidence for this, so I would not suggest you to do it. Anyways, yeah, catharsis, that answer is correct. Now you can ask one question to Grishma. Sneha. Some basic question, at least. No? Raina?
Uh,
Hmm.
Ma'am,
Hmm.
this is include like existential anxiety.
Huh? Some her topic I'm asking. Okay, I'll ask one question. What is the difference between sympathy and empathy? Just explain that and finish it off.
Ma'am, is it to me?
Yes.
Sympathy, we feel pity towards the person. We feel sorry for the person, but not enough to act on it, or we don't feel the situation. We don't feel like we are in that situation. We don't think about how we will feel if we were in that situation. But
Mm.
in empathy, we will think about how we would feel and how embarrassing or how traumatic that experience would be for the person, and we will act on it.
Yes. Yeah. How many of you have a habit of crying watching movies and films? Meghna? Meg? Reina? At least once, if you have done that, I think you are very empathetic, isn't it? That's my thought, my point of view, isn't it? That is because we can see ourselves in the position of that character. Is it not? Yeah. Which was the latest movie that you cried for, Meghna? I cannot hear you. Not audible. Try once more. Still no. Better luck next time. Elvina, what about you?
Yes, ma'am.
Which was the last movie that you cried for?
It was not a movie, it was a web series.
Web series. Which one? Don't
Op-
say Korean drama.
no, Operation MBBS.
Operation MBBS. Which language is it?
Hindi.
Hindi. Okay. Fine. So that was a good presentation, isn't it? Yes, very good. Now, who is next? Ching, ching, ching. BGM. Are you tensed, Ashish?
Somewhat.
Somewhat tense. Then relax yourself and then we'll start. Take a deep breath.
I can we do in the next class?
Next class. Okay.
I
No
don't know.
problem. But you have to.
Yes.
Okay. Then, who's next? Alternative therapies. You're doing which part? First or second?
First part.
First part. Are you ready?
Yes, ma'am.
Yes. Okay, then start. I can see myself. Hey.
So, good morning, everyone. Today I'm here to present the seminar on the topic alternative therapies. Hope you all are able to see the screen.
It would be better if you play the presentation, I think. No need, no need. Will it come upside down? We cannot see anything, Elvina. Now you do it like this, no problem. Start. Don't worry, let it be. First slide is like this, no problem. Continue.
So, we had learned many types of therapies like psychodynamic therapy, gestalt therapy, and CBT. So, apart from these, there are different kind of therapies which is known as the alternative therapies. These alternative therapies is also known as the complementary therapies, as they are not part of medicines or health related. They are main a part of or not a medical care. That is mainly to increase the well-being and the to main promote good mental health and the relaxation. So there are in this it includes different kinds of alternative therapies. They are yoga, acupuncture, herbal remedies, meditation, music therapy, and so on. But in this we are only discussing about few. That
Is
is
that
the
the
yoga.
spelling of acupuncture? Let's see. Okay.
So in this we are only discussing about the few, that is the yoga and the meditation. Yoga, as it is an ancient technique which is detailed in the Ashtanga Yoga of Patanjali Yoga Sutras, but today it is commonly known as in the name of the asanas or the body posture component or to breathing practices of pranayama. Pranayama means it is prana means the vital energy and yama means regulation or control. It means we are gaining the control. It is the main, as we can see the image right here, prana means vital life energy and yama means the regulation or control. It means we are gaining the control of energy. So in this, it also includes the body posture and breathing, and it also includes the relaxation techniques. Yoga therapy is well established as a treatment for the depression and anxiety. Then another method, it is the meditation therapy. Meditation therapy, as it is a method of relaxation and consciousness expansion by focus on a mantra or a keyword, sound or image while eliminating the outside stimuli from one's awareness. In meditation, we are only focusing attention to a thought or a breath or a mantra, and we are not aware of the outside or whatever happening in our around or outside. So in this, we are only focusing the attention on the breathing or the mantra or on any attention to any particular stimuli. Then in this, the meditation, there is one another kind of meditation, it is the vipassana meditation. In this, vipassana means to see the things as they are in their true nature or their true perspective. It is a sense of self technique or a self observation and self exploration. And in Vipassana, it is in Vipassana, as it is mainly known as in the Vipassana means it is mainly in the deep interconnection between the mind and body, and in which it mainly connection. It is not, there is a difference between the meditation and Vipassana. In meditation, we are only focusing to only one attention or one stimuli or an breath, but in vipassana we are mainly aware of the sensations in our body. So it is a deep interconnection between the mind and body. Then it is vipassana meditation, as it is also known as the mindfulness based meditation. It is also known as the insight meditation, as it is mainly to know about inner side or inner self in a non-judgmental way. In this, we know it is mainly known as the insight meditation, and in this, we mainly came to know about our true nature or the true in which is mainly not in a non-judgmental way. And it is mainly rediscovered by the Gautam Buddha about 22,500 years ago, as it is a very ancient meditation technique of India, like yoga, as yoga is also an ancient meditation. And in this meditation, yoga, as it is an ancient technique, and meditation is also one of the main ancient meditation technique of India, which is mainly rediscovered by the Gautam Buddha about 2500 years ago. So here are some other pictures of these therapies. In this, the first one is the herbal remedies. By using herbal remedies, we can cure our therapies. Like we had seen in many other therapies like herbal remedies using the herbals and other things. And acupuncture, acupuncture, as it is a form of alternative medicine and a key component of traditional Chinese medicine, in which the needles are inserted into our body. In this, it is mainly a type of Chinese traditional therapy, in which we can see that there are small pins which is inserted into our body, and while inserting this will stimulate the chemicals or releases the chemicals into our brain. So this stimulates the natural healing abilities and promote physical and well-being. So while stimulating, it mainly stimulates the central nervous system or the CNS. So this in turn releases the chemicals into the brain and the spinal cord and the muscles. So this is a natural or the ability for our physical and emotional well-being. So the next one, it is the meditation, and in this, and here it is the yoga. So these are the different types of alternative therapies which is given here, and there are other types of therapies like musical therapy and so on. So that's all about. So I'm once again revising the topics. So first we had came to alternative therapies. Alternative therapies is also known as the complementary therapies, as it is not health related. It is health related, but it is not a mainstream of medical care. It is mainly to increase the well-being or the relaxation and promote good mental health. So in these alternative therapies, there are different kinds of therapies. They are yoga, acupuncture, herbal remedies, meditation, music therapy, and so on. So in this we had detailed about the yoga. As yoga, as it is an ancient technique which is mainly it is an ancient technique which is mainly detailed in the book is known as the Ashtanga Yoga of Patanjali Yoga Sutras. But today, as it is commonly known as in the name of asanas or the pranayama, it is a breathing practice and it is mean like a relaxation, or it is a combination of the two. And yoga therapy is mainly benefit for the depression and anxiety. Then next one is the meditation therapy. In this meditation therapy, it is mainly focusing attention through our breathing or the a mantra or a keyword, and we are not becoming awareness of the things which is happening around. And in this, there is another kind. It is the vipassana meditation. As vipassana means we need to see the things as they are in their true nature or their true perspective. It is a technique of self observation and self exploration, and in Vipassana, it is a deep interconnection between the mind and body. Here we are only here we are only mainly focusing on the sensations in our body, and it is mainly so that we call it as a deep interconnection between the mind and body. Then next it is also known as the mindful based meditation and also an insight meditation. So we are mainly focusing on our inner self in a non-judgmental way. And in this Vipassana, it is mainly rediscovered by the Gautam Buddha about 2500 years ago, as it is a very ancient meditation technique like yoga. And these are those different kinds of therapies: herbal remedies, acupuncture, meditation, and yoga. So that's all about my topic. Thank you.
Okay. Please stop sharing. Yeah, that was also very good. And yeah, questions? You can ask one first, Alvina.
In which book it is mainly the yoga is detailed?
Very common name.
Ashtanga Yoga of Patanjali's Yoga Sutras.
Yes, ma'am.
Okay. Then you ask one question to her. Mehak. Or should I ask?
I don't have a question.
Okay, what is the other name for, what is Vipassana yoga or Vipassana meditation known as?
It is mainly Vipassana means to see the things as they are in a true nature or in a true perspective. And in Vipassana meditation, we are focusing to the sensation of our body, and it is a deep interconnection between the mind and body.
What is the other name for that?
Mindfulness based meditation.
Meditation. Okay. Otherwise, insight
meditation.
meditation. That's it. Okay. Well done. Now, who is doing the second part? Aishwarya. And rehabilitation of mentally ill. Did anybody get that topic? No, right? No. Mehak did not get a topic, right? For the seminar, you can take that portion, the last one. We've already discussed that in brief in the previous classes. It's a simple general topic only. How do we rehabilitate the individuals who have mental disorders or mental problems? Okay, regarding occupational therapy, vocational training, all those things. All right. So after, so next class, Ashish, you have to take ethics in psychotherapy, and Aishwarya will complete the second part. I think Aishwarya can take first, and then Ashish will take the ethics. Otherwise, the continuity will be lost. See, bulb lighting up. Okay, and after that, it'll be followed by Mehak. By that, we'll finish those chapters. Okay, so prepare and come for the next class. Thank you.
Thank you,
Thank you,
ma'am.
ma'am.